Is, ladies and gentlemen, the NFL doing enough for those who suffer permanent damage as a result of head injuries? Dr. Wilfred van Gorp is a neuropsychologist with the Columbia University Concussion Clinic. Doctor, thank you so much for being with us. So, do you believe that the NFL is hiding a deep, dark secret here?
You know, Geraldo, I don't know, I can't say one way or the other on that, but I can say that it can be very hard to diagnose a concussion. The player, of course, has to tell the coach that something has happened because the majority of concussions do not involve a loss of consciousness. There can be an alteration of consciousness. And so if the player doesn't report that, then of course the coach doesn't know and no one knows.
Can you give me 1 minute, and I hate to do this to you, doctor, but can you give me 1 minute to give us the track from concussion to suicide?
Yes, a concussion is a mild traumatic brain injury. And when there's a concussion, it can either be due to a force that occurs where the brain is shaken, or it can be due to a rotation of the brain. There doesn't have to be an impact or a hit, very much like shaken baby syndrome. And so this causes damage to the brain, and the front part of the brain is differentially vulnerable. And that's important for one reason. The front part of the brain deals with judgment, inhibiting responses, not being impulsive, and so if that area is damaged, the person can be very impulsive, make very poor decisions, and be very emotional. As a 10-year-old patient of mine said very wisely, who had a concussion, I said, are your emotions different? He paused and he thought, and he said, I'm weirdly emotional. And I think that captures the way a lot of these players are.
Weirdly emotional. I have to leave it there, Dr. Wilfred van Gorp. Is it Gorp? Am I saying that, Van Gorp?
Gorp.
Dr. Wilfred van Gorp and Marianne Esther.